Hi, I'm Dr. Michael Anderson. If you care about your health and want clear, practical medical advice, make sure to subscribe to this channel. Here I explain important health topics in simple, calm, and useful ways. Let me start with something important. Most cancers don't start with pain. In fact, early cancer often develops quietly, with subtle signals that people overlook. Today, I want to talk about those early signs, not to scare you, but to help you notice what your body might be telling you. One of the most common early signals is persistent fatigue. Not just feeling tired after a long day, but exhaustion that doesn't improve with rest. Your body uses energy differently when something is wrong, and unexplained fatigue is sometimes the first clue. Another signal is unintentional weight loss. If someone loses weight without changing diet or activity, it deserves attention. Weight loss alone doesn't mean cancer, but it should always be evaluated. Next is persistent changes in the body, a lump or swelling that doesn't go away, a mole that changes shape or color, a wound that doesn't heal for weeks. These are signs the body is asking for a closer look. Changes in appetite or digestion can also matter. Ongoing difficulty swallowing, persistent indigestion, long-term changes in bowel habits. Again, these symptoms often have harmless causes, but persistent changes should never be ignored. Chronic cough or voice changes can also be signals. If a cough lasts more than a few weeks, or the voice remains hoarse without infection, it's worth checking. Now here's something important to understand. None of these signs automatically mean cancer. Most of the time they don't. But cancer often begins with small, persistent changes. And early detection dramatically improves outcomes. That's why screening matters so much. Routine exams, recommended tests, and listening to your body can catch problems early, when they're easier to treat. Let's also talk about risk awareness. Smoking remains one of the strongest risk factors. Excess alcohol, obesity, and inactivity also increase risk over time. But genetics plays a role too, and sometimes cancer develops without obvious causes. That's why awareness matters more than blame. So what can you do today? First, notice persistent symptoms. If something unusual lasts weeks, not days, check it. Second, follow screening guidelines for your age. Third, support your body's overall health. Regular movement, balanced nutrition, consistent sleep, avoiding tobacco. These steps don't guarantee prevention, but they strengthen your body's defenses. Here's a simple plan for this week. Schedule a routine checkup if you've delayed one. Pay attention to changes in energy, appetite, or weight. Move your body several times this week, and talk to a doctor about any concern you've been postponing. Remember, this conversation isn't about fear, it's about awareness. Your body often whispers before it ever screams. When you listen early, you give yourself more options. If this video helped you, subscribe to the channel and give it a like. I share simple, practical medical advice to help you stay informed and proactive. Take care of your health, and I'll see you in the next video.